Welcome to the virtual Lubar Center at Marquette Law School, where we are continuing our longtime series of conversations with interesting people on important subjects. And we are still virtual at this point with some increasing hope of going back to in-person programs in the near future, we hope. But we're pleased to have with us today three people discussing, as I said, important subjects. This is a really important one. Youth, mental health, and the strains on young people today. I want to welcome Tracy Oerter, who is the Director of Community-Based Mental and Behavioral Health for Children's Wisconsin, which means she oversees the care and clinical excellence in over 60 mental health and school-based clinics across the state. She's been working in this field for 30 years and obviously has great expertise. She has a bachelor's degree in psychology from UW-Madison, master's degree in organizational sciences from UW-Milwaukee. Also, Brenda Mikell, who is the director of counseling at Rufus King High School in Milwaukee Public Schools. One of the premier schools in the MPS system. She has been at Rufus King for over 20 years and is also involved in RedGen as an advisor. RedGen advocates for youth mental health and well-being for kids, and especially for developing resiliency among kids. Hugh Davis is the executive director of Wisconsin Family Ties and has been since 2003. This is a private nonprofit group which advocates for improving kids' mental health, statewide organization run by families, for families, serving adolescents with social, emotional, and behavioral challenges. So welcome to all three of you. I appreciate your taking the time to join us. Tracy, you have the biggest view here, I think, because of the scope of Children's Wisconsin. I'm interested in talking about the past, the present, and the future. The past meaning what's been developing over recent years, particularly before the pandemic started. I mean, I have a strong professional interest in following what's going on in the education scene, including issues such as this. And I was picking up for several years before the pandemic that there was a big increase in issues related to mental health, what was shaping kids' lives, anxiety, depression, you name it. So the past, what's changed during the pandemic, and the present, and what you want to see ahead. That's the general agenda where we're going to go. But let's start with how did we get to this point?
Absolutely. It has been a long time in the making. Through Children's, we have been in school-based mental health programs since 2012, but really started exploding our presence in schools in the last 5 to 6 years as our strategy started to focus on prioritizing mental and behavioral health throughout the system. And as schools and school districts started to recognize the need to have mental health and behavioral health on site. I can remember sitting back at a table in Milwaukee, conference table back as far as 2007, starting to talk about how do we offer and work with and partner with schools to provide mental and behavioral health services. And it took about 5 or 6 years until we first stepped foot in our very first school in MPS. So it's been a lot of conversation and figuring out how that partnership would work. So most people know that a declaration, a national emergency in youth mental health was declared in October of 2021. And those of us who have been in the field know that this emergency has been here all along. It's just been underneath the surface. And the pandemic is really what shone a light on it and brought a lot of attention to it. And it's something that we just can't ignore any further.
Have things changed for kids particularly? I mean, as being a teen today both factoring in the pandemic and leaving it out, is being a teen today different than it was in, say, 15 or 20 years ago?
Yeah, I would say every teenager, every generation of teenagers has different experiences. What I see right now is that social media, you can't turn your back on the impacts of social media and access to information, and whether it's good or dangerous, through their tablets, their phones, their devices. And so that's one of the things that's unique to teenagers kind of today versus in other generations of teens. Teens all along have always experienced mental behavioral health challenges. It's how they've managed them, how they've talked about them, and how they've dealt with them. That's also changing with youth today. What I experience, or what I see through our work in schools, is like the pandemic has made things a lot more intensified for kids. Their feelings of stress, anxiety, depression. There's been an incredible increase of self-harm and suicidal ideation, hopelessness, lack of belonging, all those things that we've heard about and we know that our youth are experiencing because of the pandemic. That was also there before the pandemic. But what I also see, to not go too dark, is that youth today are more apt to talk about it more freely, and help each other and talk about, well, I need to go see my therapist today. Reducing stigma through having kind of that connection, that person that you can go to if you're having a day where your depression is flaring up, or feeling comfortable talking to that safe adult or that trusted adult in your school if you're having a lot of anxiety about a test and asking for accommodations. So I see on a bright side where a lot more symptoms are coming to light and more kids are in just incredible amount of crisis, that there's some hope in that they feel comfortable talking to each other and asking for help more so than their parents ever did.
Brenda, what are you seeing at Rufus King, and how does it compare to a few years ago? And what are you seeing beyond Rufus King? You have a pretty good handle, I believe, on the broader subject of how kids are doing. What do you see in a typical day or across a school year like this?
Sure. I agree a lot of what Tracy said, that probably about 7 to 10 years ago, our school support team, which consists of the counselors, the school social worker, and the psychologist, met and really, dove in and decided we need to take a new focus. And these kids there is a lot of anxiety, there's a lot of pressure. I agree, social media has really attributed to that, but we decided to really zone in and focus on mental health. So we did, pre-pandemic, start a number of programs such as Red Gen. We do Rogers Memorial Hospital has a curriculum that focuses on reducing the stigma associated with mental health challenges. We really zoned in on that. So when the pandemic did hit, I felt like our kids, for the most part, were not hesitant to reach out in a virtual setting. We had a crisis plan of how to handle should a teacher be concerned about a student's mental state or worried about maybe a suicide risk. We had a plan of how to handle that virtually. It was very challenging for someone as seasoned as I am as far as navigating that whole virtual world. But it was a good problem. We saw it as a sign. A lot of our risk assessment data increased, and sometimes that's thought of as maybe a problem, but I like to think of it as more students are reaching out and being vocal and asking for help than they were before. So we have continued doing those programs at Rufus King. We have our staff and administrators fully support everything we're doing. And I think a lot of it is because the staff has seen the benefits of that. So moving ahead, we would like to keep going with this with the students. We definitely make sure, we put a lot out there in May on Mental Health Awareness Month. We have Mindfulness Mondays where we do different programs during the lunch hours for students to kind of recenter and reduce that anxiety. So students have been very receptive to our programs. I'm just super grateful that we started really zoning in on these before the pandemic, because a lot of those were already in place.
Hugh, Wisconsin Family Ties works with families across the state. What are you seeing as far as trends and looking back a few years as compared to today?
Sure. We, to be honest, we're not really seeing anything different than we saw in the past. We're seeing perhaps some increased incidence rates, but since we're talking mostly about schools here today, the fact of the matter is that schools have always been a pretty difficult environment for kids with mental health needs. And, those kids are the ones who experience some of the worst school outcomes of any population group. And that remains the same. They are far more likely to be subject to exclusionary discipline. In Wisconsin, pre-pandemic, there are about 30,000 out-of-school suspensions each year. And the rate for kids who qualified for special education under the emotional or behavioral disability category their rate of suspension was 1,000% higher than their non-disabled peers. If you take a look at the restraint and seclusion data for Wisconsin, roughly around 20,000 incidents of that each year. Around 80% of those incidents happen with students with disabilities. So, we've seen this has been a long-standing issue, as Tracy mentioned, and I think that, and I also agree with her that kids today seem to be way more open about their emotional challenges that they have than ever before. And if there is one from a mental health perspective, I think that one of the good things coming out of the pandemic is that we're having conversations like this. These have been longstanding issues. Perhaps the pandemic is going to be the impetus that helps us address some of these things in a more effective, a more compassionate, a more humane way.
Well, that leads into my next question, which is how are we doing at addressing the needs? Let's go back to Tracy. I would mention that there was a report that came out several weeks ago from a national nonprofit by the name of, what do they call this? It's an unusual name, Inseparable. And they rated every state by how they're doing in responding. And Wisconsin didn't get the highest grades. We did okay in some areas, but basically we were short of what people in the field generally would regard as enough help within schools, school psychologists, social workers, guidance counselors, the ratio of students to people who are there to help. And the system has certainly been under high stress, even both in the private sector and in schools. So how are we doing overall at meeting the need, and what strategies seem to be having the best results? Tracy.
Sure. I think we have I think the state has made a lot of progress in the last couple of years in supporting students in the schools. I think we have a very long way to go. And the report that you had just mentioned, I was listening to an NPR podcast a couple of days ago where I heard where we ranked and some of that data, and it was stark. And it reinforces that we do have a long way to go. It's been a very kind of a grassroots development of school-based mental health, and one of the things that they had reinforced in that, or stated in that podcast, is that each school and each district is almost like its own business, and the principal is like the CEO, and how that principal runs that business can set the tone for the culture of the school and what resources and how that school is run. And we've experienced that across the state, that principals that have more investment, or I should say more knowledge, or are focusing on that amongst the hundreds of things priorities they have to focus on, are the ones that have reached out earlier and found funding, have found community partners to respond to the needs of their schools. So we still kind of have a have and a have not across the state. And that has to do with the fact that funding has been either been non-existent or has been kind of fragmented. You go for it, you get it, you compete for it, or you don't. And then you get resources. And if you're lucky to have a partner in your community that will provide those services. So we have 71 counties in Wisconsin, and most of them are shortage areas for mental health. So we have a provider shortage. And prior to 2020, a lot of us didn't have the opportunity or the access to do telehealth as well. So there was that divide to be able to provide access to kids. Now we have that. And now we have the digital divide of kids that don't have the broadband or the data or the technology to access therapists or mental health providers that might not be within their given county. So there's a lot of different variations on the spectrum of mental health support. Schools provide, they have their support staff, and then sometimes they're able to bring in external partners. Sometimes because of shortages or their inability to find community partners, they've been hired. I've heard they've started hiring their own therapists to work in the schools to provide mental health services. But there are still some schools that are ground zero and don't have anything beyond what their school may have had in terms of a school social worker that's split across multiple schools, or maybe a school psychologist that's pops in once in a while, that absolutely is critical and provides those critical services, but it's not enough given the amount of need that there are among students. And now we have teachers, well, we always had teachers to worry about. The teachers are really stressed out too. And the kids are somewhat dysregulated right now, and they're coming back. And after having a couple of years of, a lot of inconsistency in their schedules and their routines, and there's a lot of classroom disruption, and teachers, they don't know, they weren't trained in how to regulate classrooms to the extent that they have to now, and to do these types of interventions with kids that are experiencing severe mental and behavioral health issues in their classrooms. And so I think what is helping is the ability to have not only a team, the school staff, and potentially a community partner to provide services to those individuals and to kids in groups that are experiencing similar challenges, or building that peer community, but also that consultative work to help teachers and to help staff kind of build that community and have some basic knowledge of mental health concerns, what to look for, how to intervene, and what their resources are. What is their lifeline and their go-tos when it gets beyond their scope of their ability to teach a classroom? And so all those types of things are what's working, is supporting the teachers, kind of teaching them to fish, and also those interventions, both individual for kids that really need that one-on-one help now, as well as eventually moving up back in the spectrum to more preventative work and really global work with early intervention, stigma reduction, education with the entire student body, so we don't get to the point where it's constant crisis.
There have been some steps in the last few years, even before the pandemic, to increase attention on these subjects. On even a bipartisan basis, largely the state budget the last couple of years has increased mental health services to schools. The pandemic aid from the federal government, many school districts have been using it for that. Yep. And Children's, if I may say so, has made a big commitment to the subject, in large part, I believe, using the old Blue Cross Blue Shield money. and some campaigns around that. Are these steps paying off? Are they helping? Are they having an impact? Tracy, but I want to hear everybody's opinions, particularly on whether these kind of things are paying off.
Yeah, they are, but not as much as they need to yet. I mean, they pay off for the schools and for the students and the families that we serve, but there are a lot of schools that don't have services from us or for any of our from any of our other community providers who are providing school-based services. And a lot of the funding is short-term. The ESSER funding that came out, it provides some equity to all schools because now everybody has some funding to do something with, but it doesn't provide sustainability. And so there's some startup and seed money, including children's, our campaigns to get out and provide depth and breadth to our schools. But what we really struggle with and what schools struggle with is that sustainability piece and the ability to provide it to all students across the state.
Brenda, what are you seeing from your desk inside a school? Are services helping? Are they anywhere close to meeting the overall need?
I don't believe we're close to meeting the overall need, but we have realized that this cannot just fall on the support staff. So we have made a strong effort to do some training, some suicide prevention training called QPR. We have our entire staff trained. We offer it to our parents. So that is coming up on March 15th, a parent training to really educate the Rufus King and the school community as a whole, because so many of those efforts, maybe a parent might recognize some signs before someone at school does, or definitely teachers have noticed things. So just to really put some more training out there to increase the knowledge for staff and parents, because it can't, there's 4 counselors, 1,500 students. We can't meet the need of all of the students, but we can help others meet the needs. And there is no harm in students knowing multiple people have, training to deal with that. So we've made an increased effort to make that happen.
So if someone, and it could be, as Tracy was saying, an adult, a teacher or other staff member, as well as a student, comes to you or is brought to your attention, I'm struggling, I'm having a hard time, I can't get out of bed in the morning, whatever it might be, what are you able to do? What's on the menu of responses for you?
I have yet for a student who is offered a program or a club to join to turn it down. So usually what I do is I'll explain what Red Gen is. I'll ask if they're interested in joining. We currently have about 55 students in Red Gen, and that group
just from Rufus King.
Correct.
Okay.
Correct. Just Rufus King. We meet once a month and focus on resiliency, and the students really enjoy it. It's a great program. So students do not turn you down with these offers. It's not typical that they do. So the more programs, the better. I mean, we run our support groups, we run grief support groups. We do the Rogers program called HOP, where it just works to reduce the stigma. It's just giving a message to students that it's okay if you're not okay. That's fine. We will help you through it. And hoping that students continue to find that person to connect with, because the relationships, whether it's with a counselor, a social worker, a teacher, the engineer, the cook, whoever it may be, those relationships are so important. So we're making a strong effort in a school of 1,500 to make sure students do not feel alone and to have a relationship with someone in the building.
And I don't think this is a digression, but sort of define the term resiliency. How do you build resiliency in kids? What works?
what works with kids is certainly talking about it with other children or other teens. They know that they're not alone in their feelings. They know that there's other students that feel some of the fears, the anxiety that they also fear. To talk about it, so they know they're not alone in feeling that way. So, and to be able to overcome that and be able to manage those feelings in a way that allows them to continue being productive. So the students, definitely talk about that among themselves. We have also gotten together pre-pandemic, not since the pandemic, but with other Red Gen groups in other schools. So the students know this is not a city of Milwaukee, problem. This is not a suburban problem, private school or public school problem. It's a very global problem, having mental health challenges. So the resiliency that they feel tells them, I'm going to be okay. I can develop some skills to be okay with this. And that's a lot of what we focus on, is the skills to get through some of the challenges that they might have.
Hugh, what's the state of help for the students, the young people that your organization is dealing with? Is there enough help out there? Is it working? Is the picture improving?
Well, unfortunately, there's not enough help, as the other panelists have mentioned. And while I haven't read the report that you referenced from Inseparable, I have to say that this is a little bit frustrating to have this discussion, because this has been known for actually decades. For the last 20 years, we've been tracking the best available data for Wisconsin's public children's mental health system. And it's not good. And we've had a hard time getting people to listen to us. In fact, we did the most recent analysis of it last year, based on the most recent data available. And our public children's mental health system comes out in the bottom 10% of states across the nation. It's simply not good enough. And I think that one of the things, I do want to make the distinction between the public mental health system and our schools, which have, as you rightfully mentioned, have made a significant investment in mental health. I do think, however, that investment has focused on really two aspects. One has been on students, getting more treatment, mental health treatment available within the school context for students. And the other piece that's been focused on has been the development of a mental health framework and trauma training for schools, so that school staff are better prepared to recognize the challenges that some kids may be facing and know what to do to intervene. The piece that's missing on the education side, in my way of thinking, is support for parents. Parents are the third part of that partnership for our kids' education. And much, much more needs to be done, can be done cost effectively to support those families. Too often, I think that parents still get a measure of blame for the challenges that their kids are facing. And yet, I've been doing this now for 20 years. I have 4 kids myself, all of whom have mental health challenges. And nearly every parent that I've ever met is doing the best they can, given the information, support, and resources they have. That's where we need to focus with the families. And I think that if we do that, we can see much better relationships built between families and schools, and we can see much better outcomes for their kids.
So if a family comes to your attention, gets in touch for help with Wisconsin Family Ties, what are you able to do for them, or what do you advocate for them?
Well, we walk alongside those families, and we're one of the few, in fact, the only one that I know of, the only service in the state that works across all domains. We're focused on children's mental health, but we really work with the adults in the kids' lives. And what we do is we recognize that families are not going to be able to focus on their child's mental health challenges if there are other things getting in the way, if they're worried about where they're going to live next month, if they're worried if they're going to be able to put food on the table this weekend. So we work across all those domains, any domain, and help families get their needs met. Once we have that stability in a family's life, then we work with them on focusing on their child's mental health challenges. How can I better understand that? How can I work more effectively with service systems? How can I navigate multiple, very complex service systems? How can I tell my story in a way that makes it more likely for me to get the services my child needs? So that's the focus that it's individualized based on the need of every family that we work with. It's broad and holistic in nature. But it's highly effective, and we do follow a very a strict process that we walk through, but the steps within those, or the action items within those steps, varies depending on the family's needs.
I suspect I'm not breaking anything to the three of you to tell you that we live in troubled times. Whether it's the pandemic, whether it's race and equity issues, just the polarization and tension across Wisconsin, across America, and now we've got Ukraine. I mean, you have kids, I suspect, who are, for the first time in their lives, hearing talk in the news of even nuclear weapons and nuclear accidents. I mean, just terrible stuff out there. Is this taking a toll on kids? Is it on their minds? And what should parents or mental health people be doing to try to help kids, maintain some stability here and some positive outlook? Let's go back to Tracy first on this.
Absolutely. And I would add to that the climate crisis that is really weighing very heavily on our kids as well. So many things that are resting very heavily on their shoulders right now. And like Hugh said, parents want the best for their children. So do schools and communities. They want everybody to grow up to be healthy, thriving adults. And I think, if I can remember the question correctly, it's what can parents do and what can we do? I think just kind of building off of what Hugh said, we do as mental health professionals, partnering with schools, we need to focus on parents and caregivers as a critical part to child well-being and to helping support them. They're very stressed right now too. The statistics of how the pandemic has impacted adults, that trickles to kids, right? And I think we can provide more resources to them, more education, more support groups and stuff like that. Unfortunately, those types of activities and those types of preventative measures, not only with parents and caregivers, but with children really early on, have not been a priority for legislation and funding. So those have always been done by the grace of charity and of missions and maybe a donor funding to provide those types of things. That's where it needs to happen. That's where it needs to start, is on the prevention level. We have a fire burning right now, and we need to get a hold of the crisis on top of that and help the kids that are kind of psychologically burning right now. But beyond that, we need to go earlier down to daycares and to kindergartens and working with parents and caregivers to reduce the stigma, provide everybody equitable tools and access to care and education, and normalize it throughout the course of our conversation and our education, so that we don't have a fire in the future and that kids are not always in crisis, and we're looking to build more crisis oriented. I mean, they will always be there. There will always be kids that will need crisis services, but that's not where we should start. We need to move back to the more preventative end of things. And because, like I said, all parents and caregivers want their kids to thrive and be well. And so I think stigma is a big one that our kids can help us move beyond, talking about it, normalizing it in conversation, and providing resources to the whole community. There's a huge mental health provider shortage right now. So we can't work with every kid one-on-one that needs our help right now. And so, like Brenda and Rufus King, it takes a village. It takes other nonprofits like Red Gen to help build up those peer supports. It takes groups like Hugh's to work with families and make sure that the other stresses that are impacting their mental health and their kids' mental health, such as food insecurity and housing insecurity, those are all supported so that they can work on their health and wellness as well. And of course, taking care of teachers and building a community around everybody is responsible for mental health, about talking about it, about asking for help, and normalizing the conversation.
Brenda, how much are you seeing the crises of today's world showing up in the lives of students at Rufus King?
What I continue to remember to remind myself of is this access to all the crises going on is so readily available for students to view now over social media. You know, you can just scroll TikTok and see these devastating images of Ukraine, and that's something I never had to deal with as a child, viewing that constantly. And I think that is the biggest impact right now, that they are viewing some of these images and crises in the world, and it's traumatizing to them, and that's a real thing. Hearing and seeing that, so giving again the kids the chance to talk about it, maybe deviating in the social studies classrooms to have a discussion about that and what that means and how they feel about it, and not make it completely a history lesson, but maybe bringing in the social emotional feelings that go with those images, because that they're bombarded by those images in every way right now. So that's a lot of what we talk about with students in Red Gen is, limiting that social media time, putting the phone down before bed, that kind of thing, because it allows them to feel better and well. So just to talk about that, and it starts with the staff to realize, that they have these experiences going on, these visual images, and that it's okay to deviate a little bit from their curriculum and to talk about some of those things.
And Hugh, what's your perspective on how the world today is impacting young people?
Yeah, well, I get a front row seat with my own kids who are now young adults. And you're right, they are significantly impacted by what's going on in the world, even on the other side of the world, in a way that that I don't recall it impacting me when I was growing up. And we're clearly a digitally connected world, and that, as Brenda mentioned, that's part of the issue. These things are happening on their phone in near real time. But while we're digitally connected, in many other ways, we're disconnected. And I think that, if we look at some of the biggest challenges that we have within our schools, with students with mental health needs dropping out of schools at unprecedented rates. The CDC estimates that it's more than 30% of students with mental health needs drop out. With school violence, all of these things, to me, the root of all of these is a feeling of disconnectedness. And so the research shows that we as humans are biologically hardwired to connect. And when we miss that connection, really bad things can happen. And so I think that just being connected to students, to children, we as adults all want to assure them. I think that sometimes that's not necessarily the right approach, because we can't guarantee that bad things aren't going to happen. So affirming how they're feeling, acknowledging that it's hard, acknowledging that it's hard for us as adults to grapple with those kinds of things. I think that those are approaches, and building that relationship and connection with our young people is what's going to be most helpful.
So past, present, let's turn to the future. Let's say 5 years from now, what would each of you hope will have changed in terms of service to young people with mental health, emotional, trauma-related problems, including Tracy touched on one issue, which is that some of the pandemic funding is short-term. So there's going to be funding challenges for one thing, but what would you like to see, and what do you maybe expect to see a little more realistically by 5 years from now? Let's change order here and ask Hugh first.
Wow, there's so much. So what would I like to see? First that pops to my head is I'd like to see a reasonable percentage of special education costs funded by the state. 5 decades ago, 70% was funded by the state. As recently as I think in the late 1980s, early 1990s, about 40%. It dropped down to below 25%, and just recently in the last biennial budget came back up to about 30%, still way less than what is needed. And so what many school districts are doing across the state are borrowing from or taking money from their general education fund and putting it into special education. That needs to be fixed, I believe. From an overall children's mental health system standpoint, I think we need to ask different questions. We've been looking, I've been doing this, as I said, with Wisconsin Family Ties for 20 years. The things that people are saying today about our children's mental health system, the complaints, the issues that they raise, the concerns that they raise, are the same exact things that were talked about 20 years ago. And I feel that we've asked the wrong questions. We keep focusing on things like access, availability, and quality. And while those are good things to be concerned about, focusing on those is not going to change the system. I believe that there's some structural changes that need to be made in our children's mental health system in order to make sure that we stop losing these kids.
And Brenda, 5 years from now.
So 5 years from now, I would hope that working with current high school students, that it's making a generational change as they enter young adulthood, middle-aged adulthood, in that we're impacting teenagers now in the hopes that that will impact their siblings, their children someday, their families, in ways that just makes it so talking about your emotional well-being and mental health is not just such a taboo subject, and that it's okay to talk about it, and it's okay to remove that stigma, because I certainly didn't grow up with that feeling, and that's likely a lot of our students' parents didn't grow up feeling that that was okay. So that's the biggest change I would like to see 5 years, and it's not an immediate fix. It happens over time, child by child, but just to make sure that generations moving forward know that it is okay to get help, and it's okay to talk about some of the feelings you have around mental health.
And Tracy, going forward.
That is a tough act to follow. I agree with everything Brenda and Hugh said. I would add, or maybe emphasize, because they may have already said this, that all schools have holistic mental health available. It's not a matter of haves and have-nots. Everyone has access. Part of that is parity. Mental health is not, there is no parity yet with mental health. And I think we need to hold insurance companies accountable for that as well, that no kid should ever go without the services they need because their parents' coverage doesn't include mental health services or telebehavioral health. I would agree as well that it becomes we start to douse the fire and we start to work on that preventative stuff. And there's incentives for providing preventative care. It's part of the curricula. It's part of the conversation. We really start to elevate, building that community, that it takes a village, that we have more peer offerings, parent peers. We emphasize that social connectedness that Hugh mentioned is so important for kids to have, to be well and to feel like they belong and to be able to thrive. And that's actually a statewide initiative right now, is that social connectedness with our youth. And I lost my train of thought on the last thing I was thinking of. I apologize.
Oh, this is good.
Dreaming is such, it's like when you dream 5 years from now, there's so many things that need to change. It feels like we're drinking from a fire hose right now, to use a, and breaking, there's a lot of great parents, individuals, groups at the statewide and at the community level are doing incredible work to overcome these barriers and to include parity and equal access and all of the things that Hugh and Brenda had talked about. It's not just a couple of people fighting for this right now. It's a movement, and that's what's really exciting. That I do feel optimistic that with the attention that's happening at both the state and federal level, that some of these things will improve. The access to services right now, it is a labyrinth, and it is overwhelming for anybody who's stressed out, even if you know how to navigate your way through the field. We need to eliminate all that red tape. It should not be that hard. It should be one call. I won't finish that statement because I might be proprietary. But making it easier for families to access that service. And then finally, I remembered my last thought was to build up our workforce, especially with clinicians of color, to be able to work with our families and communities, and to be able to provide access and services to everybody in a way that they feel comfortable and trust.
I want to say great thanks to Tracy Oerter of Children's Wisconsin, to Brenda Mikell of Rufus King High School and Milwaukee Public Schools, to Hugh Davis of Family Ties Wisconsin for taking part in this program, but much more broadly for being long-term, strong, dedicated activists on behalf of kids and their needs. Great appreciation to you and to all your colleagues and your organizations for your efforts in such an important and high stressful subject itself. I want to add thanks to the program manager here at the Lubar Center at Marquette Law School, Hilary Dubois, who actually did the work of putting this together. I just sit here and ask questions, but we're very pleased to be able to put a subject like this in the spotlight, and hope that just the conversation alone in some ways is helpful to people and offers people some sense of what's available and what the potential is for doing better. What's more important than the future of young people? Not too much. I'm Alan Borsuk. I stay tuned for future programs coming up here at the Lubar Center, whether virtual or in person. We're eager to continue dialogues such as this, and I want to thank everyone who's listening and watching this, for being part of what makes it worthwhile for us. Thank you.